Hi everyone, we are going to demonstrate the correct steps of infection control. I'm Irish and I'm going to demonstrate the donning, doffing, and wrapping of the instruments.
Hi, I'm Stephanie Ann Parcon. I'm going to demonstrate the sanitization of instruments and disinfection.
Donning procedure. The purpose of this procedure is to provide protection from infectious contamination. Equipments to be used are disposable gown, disposable cap, mask, gloves, and safety glasses. The first step is review provider orders and facility protocols relative to the type of infectious exposure. The rationale for this, protocols may vary from facility to facility, depending on the type of exposure. The second step, choose and place appropriate PPE to be applied in a designated area for application. Some facilities have designated area for applying and removing PPE, used for infectious exposure to contain the contaminants. Third step, remove jewelry, lab coat, and other items not necessary in providing patient care or cleanup process. This is to decrease exposure to microorganisms. Next, prior to applying your PPE, perform hand washing and dry hands to ensure that there is no microorganism harbor your hands. Then, the next step is to apply gown and tie securely to cover outer garments completely. This is to provide a barrier that prevents the transmission of microorganisms to the medical assistant. The fifth step, apply mask. When applying mask, place the top of the mask over the bridge of your nose and pinch the plastic strip to fit snugly against the nose. Hook straps behind the ears. This will protect the mouth and nose from exposures when performing procedures that have the potential for spraying or splashing blood. The sixth step, apply safety glasses. This protects the eyes from splashes, sprays, and droplets. Next, the seventh step, apply cap if necessary to cover hair and ears completely. This is to prevent hair, skin, and other debris from entering the body. Eighth step, apply gloves and pull over the cuff of the gown to ensure no skin exposed. And make sure to check the expiration date and the appropriate size. The rationale for applying gloves is to prevent any direct hand contact. Doffing procedure. Doffing is a method of removing PPE in a way that avoids self-contamination. Following proper steps is crucial. First, remove contaminated gloves. When removing contaminated gloves, grasp the cup of one glove on the outside with the glove fingers of the other hand. Pull the cuff off the glove down, throwing it over the glove, and pull it off your hand, holding it in the steel glove hand. Insert the finger of your bare hand under the cuff of the second glove. Pull the glove off inside out, drawing it over the first glove. Next, remove mask. When removing mask, pull the hook behind the ears and dispose mask in biohazard bag. Next, remove safety glasses and hair covering and dispose it properly. Next, remove contaminated gown. When removing gown, untie the gown, pinch a fold in the front of the gown, and pull away from yourself. Slide arms out, being careful to turn entire gown inside out and roll into a ball. If disposable, place in biohazard bag. By turning the gown inside out, the contaminants remain on the inside, preventing exposure to yourself. Then, the last steps, perform hand washing. Sanitization of instruments. To properly clean the instrument to remove all tissue and debris. What we need is a sink with running water, a sanitizing agent, detergent, a brush, heavy-duty gloves, towels, disposable paper towels, and personal protective equipment. This equipment protects you from exposure to blood and body fluids through contact, splashing, or punctures. Not following proper protocol for sanitizing instruments can contaminate self and others with potentially infectious materials. First, I already done hand washing to follow the standard precautions. I will use scissors as a Mayer scissor and tissue forceps as an instrument. As soon as possible, any instrument that has been used for a procedure should be placed into a container of water or disinfectant or detergent. If instruments need to be transported from one place to another, place the instrument in a container labeled biohazard, following standard precautions to keep contaminated items contained to prevent exposure. Rinse the instruments in a cool water and place them in a disinfectant solutions to remove any blood or debris that might dry onto instruments. Scrub the instrument well with detergent and water. Ensure to include inside edges, serrations, grooves, hinges, and all surfaces. Scrub under running water. Ensure all debris has been removed prior to sterilization. Rinse the instruments with hot water. This removes any residue left behind from the disinfectant solution. Place instruments on a clean towel and dry thoroughly with disposable paper towel with the handles spread wide open. And make sure the instrument is in good working order. This prevents the instrument from rusting or corroding. Remove PPE and wash hands to follow the standard precaution. Disinfecting uses chemicals to kill germs on surfaces and objects. To sterilize heat-sensitive items by using appropriate chemical disinfectant, glutaraldehyde-based solution. This product may also be used for delicate cutting instruments. What we need are chemical disinfectant, glutaraldehyde-based solution, sterile water, timer, airtight container, sterile gloves, polyline towel, sterile towel, and wear PPE. I am using scissor as a Mayer scissor, tissue forceps, knife as a surgical blade holder. Ensure the instruments have been sanitized thoroughly and dried before chemical disinfecting. Recognize the implications for failure to comply with Centers for Disease Control regulations in healthcare settings.
Read the manufacturer's instructions for the preparation of the solution. Preparation instructions vary depending on the brand of product being used. First, I am done with hand washing and applying PPE. Chemical disinfectants are caustic and can be harmful if exposed to the skin. Nitrile gloves is recommended and long gloves. Prepare the solution and pour it into a container with an airtight lid, being careful not to splash the chemical. If the lid is not airtight, evaporation can occur, causing the product to lose its potency. Splashing can lead to serious injury to the skin and mucous membranes. Place items into the solution and completely submerge. Exposed components of the items will not achieve sterility. Close the lid securely and label the outside of the container with the name of the solution, date, and time required according to the manufacturer for the sterilization procedure. Exposure time must be precise to ensure sterility. When the required processing time is completed, lift the lid and remove the instruments using the sterile gloves. The item must remain sterile. Rinse the instruments thoroughly with sterile water. This will remove any chemical that has remained on or inside the instrument. Place the instrument on the sterile polyline towels and dry completely. Using sterile towels, I am using paper tissue as a sterile towel. The polyline towel acts as a barrier for the sterile and prevents contamination while drying. To prepare for sterilization, place the instrument inside sterilization pouches. Remove PPE and dispose of properly, and wash hands.
Wrapping items for autoclaving. The purpose of this procedure is to wrap items to be autoclaved so that they will be protected from contamination after the sterilization process is completed for storage and handling. Equipment to be used are autoclave paper, autoclave tape, items to be sterilized, sterilization indicators, gauze, tip protectors, indelible pen, the first step is perform hand washing and assemble all necessary items. Some offices may require the use of gloves in performing this procedure. Check your office policy. Next, ensure the items have been sanitized before wrapping for autoclave process. Check items for flaws and make sure they function properly. Instruments must be working properly and materials must be in usable condition. Then, place 2 squares of autoclave paper adequate in size to wrap items on a clean, flat surface in a diamond shape with one corner of the paper facing towards you. Place item as well as sterilization indicator in the center of the paper. Placing a sterilization indicator on the inside of the package ensures sterility of the contents, which is required for quality control. Place gauze between any hinged instruments and keep all ratchets open during the sterilization process. All sharp tips on instruments must be protected with tip protectors or gauze. Keeping the instruments open ensures that all parts of the instruments are sterilized, and covering the sharp tips prevent the packages from being punctured. Then, next, wrap the items using the first square by folding the corner of the paper towards the center and turning a small corner back towards you. Continue wrapping the items by folding one side towards the center, leaving a small corner towards the back on itself, and then do the same with the other side. Fold the package up from the bottom and secure folding the last corner back on itself. Wrap the package in the second square of paper using the same technique. Be sure there is no opening and seal with autoclave tape. Wrap items snugly. Double thickness and complete enclosure prevent exposure to pathogens. The autoclave tape, which is heat sensitive, serves as a sterilization indicator and should be placed over the final tab for ease in opening wrap packages after autoclaving by taping 1 to 2 inches of tape to the edge of the package. If the package is too tight, the steam flow will not be able to get through package. Packages that are too loose or leave gaps could threaten the sterility of the contents. Then, label the contents and write the date and your initials on the tape. This is required to identify the contents and ensures accountability and responsibility. Sterilized packages are considered sterile for 30 days from the date of sterilization. Then, place wrapped instruments in the autoclave for sterilizing and return all unused supplies to the proper storage area when finished.